One.
Good evening, Bermuda. Welcome to a conversation with the Premier of Bermuda, the Honorable David Burt, and Bermuda's Science Advisor, Dr. Carika Weldon. My name is Aderonka Batamosi Wilson, and I am your moderator for this evening's conversation. Good evening, Premier.
Good evening, Director Wilson. How are you today?
I'm wonderful, thank you, sir. And you?
I just finished grilling some chicken, so I'm all right. I just need to go home and get to eat it. It was a lovely day outside, so, outdoors, and went to the grocery store, picked up some chicken, went home and grilled it. So I'm, looking forward to eating it when I return back.
Excellent. Well, thank you. I hope the chicken's good. It sounds it. Dr. Weldon, good evening. Welcome.
Good evening. It's good to be back.
Yes, good to see you. And thank you both for joining us for today's conversation. What we're going to do is we're live on Facebook, we're live on CITV, and we're also live on government's YouTube channel. And for those people who are watching us this evening, please put your questions on the Facebook page, and I will post them to the Premier and Dr. Weldon. And so let's get started. So Dr. Weldon, let's start with you. Tell us about the vaccine. Tell us again how it works and why it's important for people to consider getting it.
So the vaccine is kind of like an internal protection, right? For any virus. We've been using vaccines for decades now, but the COVID-19 vaccine is to ensure if you ever get infected with the virus, that your body is able to fight it off, right? Now, that's in addition, and this is important, in addition to the external protection, which is wearing our mask, socially distancing, washing and sanitizing our hands. So those two things have to work together, right? Now, it's not surprising, and it shouldn't be surprising, that someone who is immunized, meaning they've had both shots, and it's 2 weeks after, can test positive. Because if you're not wearing your mask, if you're not washing your hands, and if you're not social distancing, and you're in contact with someone who has the virus, it's nothing stopping it from entering. So that shouldn't be shocking. But the vaccine itself is internal, kind of like soldiers ready to beat this thing up as soon as it recognizes it. It has memory. Our immune system has the memory to recognize it right away. And it should, number one, be able to get rid of it a lot quicker, which means that you shouldn't get sick. And also means that you shouldn't have too much of the virus, or a high viral load, as we call it, in your system and be able to pass it to others. So a bit of a difference from, okay, if you get the vaccine, you can't test positive. You surely can if you are exposing yourself to people who are infected, even unawares, or not following the social distancing and washing of hands. But what you will find is that you are going to have milder symptoms or no symptoms at all, and you shouldn't, find yourself, hopefully, being in the hospital, of course, and then you should be less likely, again, not 100%, but less likely to give it to someone else. So it's something to consider, because right now we're in an outbreak, as I think we all agree, and being able to not give it to other people is a really big part of managing an outbreak, right? That's why we test, isolate, trace, and then isolate to find out where it's going. If I'm a dead end for the transmission, that really reduces the spread of the virus during this outbreak. So it's something to definitely consider, and also consider, being someone of my age. Obviously, I'm 30. I am able to be vaccinated, and I don't have children yet, but I do have cousins and I don't have nieces and nephews. My brother will kill me for that. Not yet, but I do have little cousins. Like, I know that I don't want to be able to give it to them who do not have any way right now to be vaccinated. So it's something to think about that, especially with our schools being affected right now. So it's not just a decision about you. Yes, it's beneficial to me, but it's also beneficial to others that I come in contact with who aren't able to protect themselves right now.
All right, thank you, Dr. Weldon. Premier, what do you say to people who are on the fence right now and just thinking about getting the vaccine, or who are saying, oh, I'll wait till after the summer when I can travel again. What do you say to those people?
What I'd say is have a conversation with your doctor and take advice from a medical professional. It's something that I think is necessary. And the best way to see the end of the pandemic is by getting ourselves to a place where we have herd immunity. And so with the viruses right now and where our projection, our population is, the main things about managing an epidemic is to make sure that you can reduce transmission and get that famed R number below 1. If 50% of the population, for instance, had a vaccine, then it would be very difficult for you to see that R number going above 1, but you need to continue. And so the target is 70%. And the more persons that get the vaccine, the greater collective protection that we have, and the greater that we can have relaxation of further restrictions.
And so I'm looking at a question that that just came in from those who are on Facebook and other social media. Why are we bothering to get vaccinated with the virus with such a low mortality rate? Why would we bother? Why is it imperative that we do this?
What I would say is that an overall perspective is that if you, the number one thing is that mortality is not the only thing in which you're protecting yourself against. You're protecting yourself against illness and you're protecting yourself against long-term effects. There are people who have not died from the coronavirus disease, which is caused by the coronavirus, but there are those who've had long-term debilitating effects that they're still carrying on. And Dr. Weldon can speak more about that. So this isn't just about death. This is about the long-term effects. And the fact is that on a broader level, the virus itself for protection of the entire community. The fact is you may have a strong immune system, but if you're a carrier and then you pass it on to someone else who has a weak immune system, then that person could be more impacted. So I think that we can't be talking about ourselves on an individual basis. We still need to be talking ourselves on a collective basis as a country.
Premier, sorry, go ahead, Dr. Weldon.
To add to that, I think obviously something that keeps being said is 12, like the number 12 keeps being said, oh, it's only 12, it's only 12. And I know for our population, that seems like when you do the math, that seems like not a lot at all. Two things, a number of those 12, actually majority of those, and I would take this opportunity to say that I pray for their families that they are comforted by, as much as they can be, right, in this time, and that they're, strengthened through this time. A number of them were in places where they couldn't get it themselves, right? And that's a fact. They didn't go out and contract it themselves. They were passed it by someone else who probably didn't even have symptoms. So it's like the Premier said, we can't just think about ourselves. It has to be about everyone else, because you could be healthy and get over it, but before you get over it, give it to someone else who cannot. And that's a reality. And that's something we have to think of. The other thing to be mindful of is that, yes, we saw a period, I think it was 9 months or so, when we didn't see any fatalities from this, but that wasn't because we just for no reason. It's because we were testing everyone and we were on alert, and we had, I know our lab, we had days and days of just negative tests for a long time, but at least we knew everyone was checking their status. But we did unfortunately get to a point where we got comfortable. And that's where we have to be mindful as a country that what we do individually does affect the collective.
Thank you, Dr. Weldon. Premier, last night you announced the restrictions that are being put in place to help stop the spread of the virus. One of the questions that we have is, how long will the current restrictions be in place?
Thanks, Adironka. The first instance is last week we announced a set of restrictions, and those were to run for 3 weeks. And so the ones we put in place will be reviewed in 2 weeks' time, and to see what adjustments, if any, may be necessary. Also, as I indicated last night, when I had given during our press conference, I said that there may be some minor revisions taking place this week, depending on how we might be able to position things. But persons should look for a first review of the restrictions broadly in 2 weeks' time. And that will be the time period that will be coinciding with the 3-week announcement and the initial closures of which were put out for bars and clubs last week.
All right. And so what do we as a country need to do to get past this? How do we get out of this outbreak that we're seeing right now?
I think it's important to look at the trajectory of the last outbreak that we had in November into December, and how quickly we went up and how quickly we went back down. And that is because we do have significant testing capacity in the country, so we can isolate people who may be infected. And as long as we are doing our part in separating ourselves where the virus cannot pass itself along to others, we will be okay. Recognize during that time, we did not have to institute mandatory remote working from home. We didn't have to take the measures of which we've done. We didn't have to stop indoor dining, et cetera. But we were still able to get that figure down very, very quickly. And that's because of the capacity that we have inside of the country and the ability to respond quickly. That, however, was with a less transmissible variant, as Dr. Weldon calls it, the wild type variant, which is not the specific variant of concern. But when we have the variant of concern, this UK variant, it seemed to be much more transmissible. All we need to do is to reduce transmission. And the only way to reduce transmission is to ensure that we are not interacting with people. We are taking all the precautions which are necessary. And that would mean that if the virus cannot pass itself from one host to another host, then it will not be able to survive once your immune system beats it off. And so that's the challenge. It is to reduce transmission. And once we reduce transmission, once we separate ourselves, and that is what the restrictions are meant to do, to reduce the possibility of transmission as much as possible so we can see those numbers decline. Whether or not we're at the peak, I don't know. It remains to be seen. It may have passed us. It may be in a couple of days. It may be in a week or so. It remains to be seen. But the most important thing to do is to take precautions and adjust as quickly as it went up the last time. It can go down quickly if we take those precautions.
So one of the questions that we got that came in, Premier, is asking you to give your thoughts behind a full 2-week lockdown to, as it were, reset the country, reset the island.
The first instance is it would not be a 2-week lockdown. In order to actually do something, you have to do at least 2 incubation periods for a full lockdown. And that is tempting on a change in strategy of the country. The country has never had an elimination strategy. We've had a very hard mitigation strategy to suppress the virus, but we've never had an absolute elimination strategy. And so we're not looking to change the strategy of which the country has been going through at this time. We do not believe that we need to have a full shelter in place. A full shelter in place and full lockdown would certainly be helpful for the contact tracers and other persons, because one of the things you can do is you're not going anywhere. But that's the reason why we put in these restrictions, to make sure people do not move, to remain in place as much as possible. And so with the pace of the vaccinations of which we have, with the other work that's being done, with most of the persons who are following the precautions and the very high level of restrictions which are currently in place, we believe that will be enough to reduce that R number and get a grip as to where we are with this outbreak.
Okay, thank you. What are the consequences of those who break the health regulations?
The consequences as set out in law? Happy to share. I have the law in front of me because I figured that a question like that may come up. So I have all of my references which are here. And I will just read from the law. It's Public Health COVID-19 Emergency Powers Regulations. And it says offenses. And all of the offenses of which are all of the matters of which are laid out, all the rules, all the regulations. It says a person who fails to comply with any of these regulations commits an offense and is liable for a fine of $6,000 in respect to a first offense. For a second or subsequent offense, a fine of $10,000 or imprisonment for a term not exceeding 3 months, or both such a fine and imprisonment. And then in addition, in the case of a continuing offense, a fine of $1,000 in respect to each day in which the offense is committed. Additionally, there is an additional provision in here for the requirement to wear a mask. And it says a person who fails to take all reasonable steps as required by Regulation 4 to maintain appropriate physical distancing by not wearing a mask when one is required commits an offense and is liable on summary conviction of $500 in respect to first offense, or a fine of $1,000 for a second or subsequent offense. And those penalties can be enforced by the courts, and they can be varied by a judge. So a judge, that's the maximum. So it's a maximum of $6,000 fine for first offense and $10,000 or 3 months imprisonment for a second offense for any of the violations of the regulation, and violations for mask wearing currently are $500 for a first offense and up to $1,000 for a second offense. Those get processed through the court system. One of the things that the government has recently introduced is something to make the process a little bit more simple. That will go to the Senate on Monday, pass from the Senate next week, and hopefully go to the governor to have additional measures which are introduced, which are called fixed penalties, whereas the police will have the power to issue a fixed penalty. And so it's something that you can appeal to the courts, but it's something that is also able to be paid. Whereas right now it goes to the formal process of conviction. A file has to be prepared, goes to DPP's office. The DPP must bring it forward to the courts. The DPP, I understand the BPS and DPP are working on these provisions, and I do know that there's expected to be a significant number of cases which we brought before the courts, not next week, but the week following.
So what should somebody do if they see somebody that is in contravention of any of the regulations or indeed the law, and they're clearly aware? So let's say, for example, they know that there's a party taking place. What should somebody do?
Call 211 and the police will go ahead and respond. 211.
Thank you, Premier. I've got another question that's come in. Do you think people that are waiting for results after being tested should be isolated just in case they are positive? We understand people are waiting days for results, and if they are positive and are about to go about in the community, they could be passing on the coronavirus.
I'll leave that to the lab director to answer the question, because I'm quite certain that no one is waiting days for the results.
So this is about positive results, Mr. Premier. So the difference between a negative and a positive is a negative we do send via email, and people will get those within 24 hours, and we have been steady within that time frame, even with the surge of testing. And I will say this as well, because I continuously get emails to the MDL email asking for the official report. For negative, those who are negative for COVID on their test, there is a link in the email for your official record. So you don't have to ask the ministry, you don't have to ask your doctor, you don't have to ask the lab, you already have it. Now, because it's to be positive for COVID-19 is, a big deal in terms of medical diagnosis, it has to be relayed by a medical professional over the phone. We cannot send a positive email to someone. And so because of that, that now narrows down the fact that you need to have someone to call, right? Now, how it's supposed to go is every time I input a positive result, the system is actually designed that the GP that is tagged in real time can see that same result. So there is no delay between me entering it in and the doctor seeing it. But what is happening is some of the doctors are not necessarily calling as soon as they should. And that has been identified as an issue. We had a meeting not long ago, about 2 hours ago, with the GP community to remind them of this responsibility, that it's them who need to make that initial call and inform. Now, there have been many people before who got a call from the ministry, and that's the first time they were hearing. Now, when there were 4 or 5 cases a week, that was manageable, but not when there are 80 cases in one day. So it has to be a partnership between the ministry and the doctors, right? If someone is going to get tested, if they have the slightest inclination that they might be positive for COVID, I would recommend you not go about in the community gallivanting. Maybe just go and sit and wait for the result. Because if you feel that you have it, you go and get tested, but then you're out and about before you get the result, that's slightly defeating the purpose. If you were getting tested for outbound travel, I would also say, go get tested, have a moment, and keep to yourself, because we're at a point where people trying to leave the country are also coming up as positive. So it's to that point. If you go get a test, just monitor your movements between the test and your result, because in case you are positive, it actually saves a lot of work for the contact tracers.
Absolutely. And there's also one thing that I'd like to add on that. If you have symptoms, you shouldn't be going anywhere. But if you do not get a negative result within 24 hours, I'm not going to say assume that something's wrong, but you should probably ask a question, because the MDL is pretty good. So there's one of 2 things. Number one, they have the incorrect email address. And if you signed up for your appointment yourself, that would be one instance. Or the second one would be that they are unable to send you an email because your result is not a negative result, and it has been communicated to the doctors. And so there's been some challenges. I was speaking to a doctor on Friday where there were a number of results that came in, just like Dr. Weldon said. People were testing for traveling. They were in their office working when they were contacted by the doctor late in the evening, because of course you're getting ready to travel. You're trying to finish up all things at work. And they were basically said, you are positive. You need to make sure you isolate. The Department of Health will be in touch with you for contact tracing. So it is very important. And I think that one of the things that have been said, and Dr. Weldon, I don't know if you can speak to this a little bit more, because I know that you're in the case meetings, which take place on a daily basis. Are the symptoms a little bit different this time around, or it seems, or milder? Because I know a lot of people are mistaking them for possibly allergies.
Yeah, I wasn't privy to all the symptoms before with the other strains, so I can't necessarily compare accurately. But it does seem this time a very stark reality is that it seems to sit longer in the host. So you may have had an exposure 10 days ago, and on day 14, we had a number of day 14 out of quarantine tests that were positive. So these are dating back to some of the earlier exposures that we were aware of, and we're still having people test positive. So, and just again to remind that how this all kind of started is, yes, we have the travelers continuum that you have arrival day 4, day 8, and day 14. And yes, usually you wouldn't test positive after day 8, but that's literally what happened on day 14. And then here we are. So it seems to be that's the trend. And with that being the trend, that is why it is so, so important that when you do your quarantine for 14 days, you stay put. Because how devastating would it be to know that you sat there for 8 days and then you said, yeah, I think I'm fine. And then went about for 6 days, or, whatever the case was, and then found out on day 14 you were positive. And then now the contact tracer has to date back 6 days worth of contacts. And that's where you now have one person that has 80 to 100 contacts. So it really helps if we keep in mind that this virus sits longer, and that's just from the data that we're getting. It will kind of be like a silent assassin. It's just sitting there waiting for you to think you're fine, and then it shows up. And then also it seems to spread faster. So again, a big difference before in the other outbreak, we used to have, we had one person in the workplace, we would test all of their contacts at work, and maybe we would have maybe one case that was as a result. And we're not talking about much of a different time span, but now in the same time span, you have one case, you have about 7 people at work. So it's like, it's going a lot quicker. And as for the symptoms, this was brought up today in the case meeting, that it is mild, especially for those who are vaccinated. You may not even think it's anything. If you're used to having a runny nose, if you're used to having a little cough here and there, it may not seem like much different. But on reflection, when persons are finding out, they're like, oh yeah, that was like actually quite different. So if you have any doubts in your mind, just go get tested. I think we might be one of the few countries, or maybe the only one, that has free testing for anyone that's in the country. Like, you can literally just go and wake up this morning, walk up and go get a test. So it's better to know than to be speculating and think you're not.
So just listening to what you're saying, are you recommending that even after 14 days of isolation that people consider going and getting tested at day 18 and maybe day 20?
Well, we test on day 14. That's our policy. We test into quarantine or isolation. So, isolation is for those who will test positive. Everyone who tests positive, they should not, and I will emphasize this, please do not go to anywhere else to try to get a test to see, maybe I can dodge a quarantine by being negative. No, that's not how it works. If you are positive, you have to abide by the 14-day quarantine. If you get a negative test within that period, it does 0.00% of shortening your quarantine. So save the tester, save whoever is taking you to the testing site, save anyone you might come in contact with, because that is a risk. So I'll say that. So that's those in isolation. Those in quarantine as well, getting a negative test during it doesn't change anything, but we test in and we test out. So there's like a start and an end. On the day 14, if you're negative, then you are, I guess, released back into the community. And that's really an important test now, even more now, because we see that during that time is actually when you pick up a lot of the cases.
Thank you. Thank you. So, Premier, I've gotten this another question. What is the end goal as far as returning to some level of consistent normality? What is the end goal as far as returning to some level of consistent normality?
The end goal is to get ourselves to herd immunity. And I think it's important to go back, I guess, from a strategy perspective, because there's a number of comparisons that people make to other locations in different countries that have followed different strategies. There's some countries that were just like, we don't have the capacity, we don't even need to deal with this, let the virus run its course, and we'll get herd immunity from everyone getting sick. And they see massive amounts of death, overwhelming of their healthcare systems, et cetera. There are other countries that have gone to a complete elimination strategy. And they said, you know what, we're going to lock, shut down, eliminate, try to make sure we eliminate the virus, make sure there's no possible chance of the virus to enter the country, and then go on as normal. Clearly, we're not doing either one of those. We've gone with what is a suppression and mitigation strategy, but we try to make sure that we do a very good job at suppression and mitigation. And so we have very, I would say, stringent checks at the borders, a very strong test regime, the only country in the world where if you're traveling to it, you're going to have 4 or 5 tests upon entry to the country. Other countries do 1 on arrival, other countries do different things. We do a significant amount of tests. So when we get to the place where we are right now with vaccines, the view is to vaccinate as much of the population as possible to ensure that we can have herd immunity and reduce transmission. At the same point in time, as I had indicated previously, that we are going to be increasing the protections at the borders. So non-vaccinated travelers who are returning to the country will soon be subject to a period of quarantine. And that quarantine will be probably, the science team was speaking the other day, and I'd gone back to get them of what will be the amount of times of which will be adequate, but there will be quarantines for non-vaccinated passengers at the border. And at that point in time, I think that we can call it that it will still be the test regime. So people will still have to test upon entry, day 4 to 8. We're still going to have as strict as possible, but there will be different types of quarantine setup. What will then happen is that we believe that we'll be in a relatively safe bubble, and we're just going to have to continue to do the monitoring, continue to do the testing, continue to do the surveillance, and continue to do it. As time goes on, there'll be more and more and more treatment options that are available for the coronavirus. One of the things is that Pfizer apparently now is doing an I was speaking to one of my doctor friends last night. Pfizer's doing an oral, I'll get it wrong, Dr. Weldon might know, not necessarily your area, protease inhibitor or something like that. Dr. Weldon might be able to speak about that, but it's something else too that deals with reducing the virus for people who may become positive, just an oral pill that can reduce the amount of time that the virus may be in your system, et cetera, different things. So there's more treatment options that are available. And that's why I always tell persons that we're in a different time than where we were last year. So when people are saying we should lock down and go ahead, I'm saying we're in a completely different time than last year. Last year at this time, we had no testing. There were no treatment options. We weren't available. We didn't understand what was there, and there were not vaccines. This time around, we have one of the highest testing rates in the world. We have one of the highest vaccination rates in the world. We have incredible testing capacity, and we have additional testing modalities which are coming online, such as rapid flow and lateral flow tests, which Dr. Weldon can speak about as to how those are be able to be possibly used as we go forward. So we have a lot more tools in our arsenal. But the view is to get ourselves to a place where a significant number of the population is immunized. And at our current rates of where we're going, and I have to say that I'm so pleased with the amount of people who are taking up the opportunity to go ahead and get vaccinated. I do know that there's a significant amount of people who push back against the vaccine. And as the government has said, we are not going to force anyone to get the vaccine. But we are pleased that so many people are voluntarily getting the vaccine. By the end of this week, by our projections, we will be at about 36% of the total population that have had at least 1 dose. And that is significant. By the time we get to the end of April, May 1st, the projections are that 54% of the population would have had at least 1 dose. And so that means that we're now above 50% of the population having 1 dose. And then when they get the second one, that becomes a place where it's even more difficult for the virus to, continue that trajectory. And if the current trends continue, that by the end of May, at this pace at which we are going, we will be at a place where we are at 70% of the population having at least one dose. And then when they get their doses to follow up, it looks like we'll be able to be in a place around June, late June, that we will have that. And so that's the goal. The goal to the place of normality is to getting ourselves herd immunity, increasing the restrictions at the border to ensure that we can continue on this and not continue with the cycle.
Thank you, Premier. So what does normal look like now? Will we have any kind of limitations on us as a society, or will we just be open with lots more testing or having testing in place, period? What does normal look like?
It would be difficult for me to speak on that. I'm not sure if Dr. Weldon would have an opinion either. I mean, the future, it changes so quickly. Dr. Weldon will tell you this: an RNA virus. RNA viruses notoriously mutate very quickly. Dr. Weldon laughs at me because a year ago I didn't know any of these terms, and now I have all these various terms and different things. I've learned more about viruses and virology and molecular items than I ever wanted to or dreamt of learning. But it's a good question, and it's difficult to know and to understand. I think that from the perspective of when we get ourselves to a place of herd immunity, when we get ourselves to increasing the protections at the border, restrictions for persons who are not vaccinated upon return and the mandatory quarantine periods, I think that we will find ourselves to be able to get to a place where the mass will be able to go. There will be you'll be able to have large events, you'll be able to do things like that. So I think that we can get there. Certainly do. I don't know if you have any opinions or thoughts, Dr. Weldon.
One of the things I like to describe is herd immunity, which is something that we throw around quite a lot. But essentially what it is we are trying to create, if you think of having those who cannot be vaccinated inside of a ring of us outside who are able to be vaccinated. So on the outside, we are like holding together like this, and everyone in the inside is those who can't. Now, at the minute, everyone inside is a lot more than us on the outside, and that's the problem. Once we get more to a place where there's less inside than are outside, and there's more of us protecting the rest of the community, then we can start to think about getting back to normal. But we can't have that conversation yet. We can't. So it's just, we need to continue to get out there, become vaccinated, and still follow the guidelines. Because until we get to the number crunching into May, June time, then we need to still be vigilant. There is a light at the end of the tunnel. I think that's probably the main message. And I think, again, as the Premier alluded to, we have a lot more. I know last year this time it was just me and two others, right, who were doing testing. This is before I even came, so I was just trying to get the lab set up. Now we've had over 30 young people come to the lab. We have currently, I think we have 16 full-time young people on staff. We're in a different position where if we wanted to, based on what we did last year, we probably could start up multiple labs in the country if we wanted to, right? So we're in a very different position. We can do a lot of tests. We're keeping up with the 1,000 tests a day. We will potentially have a rapid test in use. We have saliva, which is obviously a lot nicer than having something shoved up your nose all the time. So we're in a different place, but we have to also do our individual part.
Thank you. Thank you both for answering that question. Another question from that's been sent to us: is government considering implementing digital COVID-19 passports like New York and other places?
The answer to the question is yes, absolutely. And the intention is to have those in place by May 1st. I actually have in front of me that I printed out the proposal for a COVID passport. And it will be based on QR codes, certainly, based on QR codes. I think that it's important. It's a question of when and how it will be used. I think that the use will be limited. I don't think it's going to be something, I think it'll be at the border will be one thing, and I think it'll be part of the travel authorization process. So there's a process for verification, someone's vaccine status, so they can come in and have something that they can show and share. And I think it might be other place where it might be used locally is for large events. I can't see it being used on a daily basis for just simple day in and day out use. But the considerations are there, but we are going to be launching something. So, and a vaccine passport just is, a simple way of having your vaccine card, except for it's something that can be digital and something that could be a lot easier and can be used and can be stored in your phone. So you don't have to, I would say, carry around that card, which could easily be faked.
Yes. Thank you. Thank you, Premier. Another question that's come in, any plans to get any of the alternative vaccine options, for example, AstraZeneca, Johnson & Johnson on the island?
I can speak to that, certainly. The first thing that I'll say is that yes, the answer is yes. For the COVAX facility, there will be other vaccines that are coming. I know that in the shipment that the United Kingdom government is sending, which is either next week or the week following, there will be a small amount of AstraZeneca vaccines on that shipment. I think the number is only 100 because there are some persons who cannot take the Pfizer-BioNTech vaccine. So they have to take the AstraZeneca one. Those are people who have medical indications that they cannot take the Pfizer-BioNTech vaccine, not people who say, I don't want to take the Pfizer-BioNTech vaccine. Medical people who are vulnerable, who cannot take that particular vaccine. And so when the COVAX facility arrives there, I think they're supplying AstraZeneca. They may be supplying Moderna. They may be supplying Johnson & Johnson. We don't know. The view of which everyone has said around the world, people who are scientists and people who are doctors, they say very clearly, take what is offered to you, as they are all efficacious and they all have very good protection against serious disease, which is the number one thing. So we are very fortunate to have the Pfizer vaccine. The United Kingdom government has supplied them free of charge to all overseas territories. It's allowed our overseas territories to continue to vaccinate people in significant numbers. If you look at the global charts, and you can see the top countries in vaccination, about most of the people in the top 10 are United Kingdom overseas territories because they've been able to get these vaccines and go ahead and get them out very quickly. So from that perspective, we are looking at others, but right now we have Pfizer-BioNTech, which we're not doing vaccine races, but in the preliminary trials and the trials, it was one of the most efficacious. So we've got a very, very good vaccine. And it's important that we do our best to have the vaccine take-up, which is necessary. And I think with this vaccine and the vaccine take-up, we will see, as has been seen in another country, which is used the Pfizer-BioNTech vaccine exclusively. You can see the trajectories of what's taken place in Israel and the rapid downturn of their infections inside of the country.
Excellent. Thank you. Thank you, Premier. I have a question about the WeHealth app. Premier, can you speak to that? Can you speak to why the WeHealth Bermuda app is important and why people should download it?
Happy to take a stab at it. The most important thing about WeHealth is that it is anonymous exposure notification. The way in which you prevent virus transmission is to know if you are exposed. And if you are exposed, you go ahead and get tested, and then you isolate yourself. And make sure that's what it is. If you have a virus, if you are not interacting or putting your place where you can pass that virus on to somewhere else, and you stay by yourself, the virus your body will kill it off, and it cannot go to anyone else. That is the way that viruses work. They require a host to live and to survive. If you have the WeHealth app, and if other persons have the WeHealth app, if I go ahead and test positive, the contact tracers will ask, do you have the WeHealth app installed? You will say yes. They will send you a random code, which you open up the app and you type it into the app, and the app will automatically and anonymously notify your contacts. So the contacts who you would have been in touch with, these may have been people who you might have been standing in a supermarket line for 15 minutes or more, or you might have been somewhere. It times how close you are with other persons just by measuring the signals between phones, and completely anonymously sends that exposure notification. If you get that, where a number of people have gotten that, they can call the Department of Health. The Department of Health will recommend them for testing and tell them what to do next. That's why it is important, and the more people that use it. So one of the things, of course, which we're going to be looking at, especially when we're going back to reopening indoor dining, et cetera, is going to be the need to have these type of things if you want to be in situations where it will be more of a risk of transmission.
Thank you, Premier. I do have another question, and the viewer is asking, do you plan to shut down the airport?
No. The airport is something that is important for Bermuda. It's not just about tourists. It's about persons who travel for medical reasons, persons who travel for academic reasons. Not everyone is going on a shopping trip to New York or a ill-advised party trip to Miami or Atlanta. That's not what everyone is traveling for. And the airport is our lifeline and connection to the rest of the world. Our restrictions at the border are very strong in places and times for a significant amount of time. They've proved effective. We clearly will have to do some modifications as we move forward. As I indicated, we will be introducing mandatory quarantine requirements for non-vaccinated travelers in the near future. Those will be for visitors and also for returning residents. But I think, as Dr. Weldon has stated many points in time, visitors are never our problem. They are never our problem. It is persons who are residents who do not feel as though if they need to follow the rules. And that is the reason why I sympathize with the views and calls of other persons who say that we should reinstate mandatory 14-day quarantine. And what I will say is that there will be restrictions that are going to be introduced as we increase our pace of vaccination, as vaccines are widely available in all of our gateway cities, to implement heavier restrictions at the border for non-vaccinated travelers, whether they be visitors or whether they be residents.
Premier, last week you spoke about the unemployment benefit. Who's this for, and who can apply to get? The
unemployed benefit is available at uba.gov.bm, and it is available now to any person who has been negatively affected due to their job. That is, that they cannot work because the government has closed their job. So 2 weeks ago, that was just bars and nightclubs. Now that may apply to some persons that are working in restaurants, persons that are working in gyms, and persons that are working at indoor places of, as it's called in legislation, public resorts. So cinemas, museums, and others. And so anything that has been closed by the government, closed by order, persons are able to apply to uba.gov.bn. For persons who were in the bars and nightclubs who did get payments in last year, December, they do not have to reapply. What will be done is that their employer will check, the government will check with their employer to find out if they are still employed at that establishment, and they would automatically get the $1,500 payment, which covers the 3 weeks. If you did not get any monies in December, then you can apply. But if you did apply, you're at the same establishment, the same place where you're working back in December when these payments went through, those payments will be automatically sent to you. For persons who didn't get the payments, they can apply. And for persons who were affected by the closures, which came into effect today, they can go online to uba.gov.bm. It does say affected by bar and nightclub closures still on the website. That will be adjusted tomorrow, but you can go ahead and apply at uba.gov.bm.
Thank you, Premier. Dr. Weldon, I have another question. Can you get a positive result if you've taken the vaccine?
Oh, that's a really good question, because if we were talking about any other vaccine, the answer would actually be yes. Because the way that the vaccines normally are made, conventional vaccines, they are usually weakened versions of the same virus, right, that you're trying to protect you against. And so you do find that some people with weakened immune systems, that they actually do get the actual disease, and then they could test positive. The reason why something like that, it has been, we're trying to improve on that, is because we don't want people to get the actual disease. Like that's not a good thing, right? And so scientists for decades now, since I know from 1990, the year I was born, I have to always say that, they have been working to create, vaccines that do not and cannot ever give you the disease. And so that's where we are now with an RNA vaccine, which has been worked on since 1990, where it is the instructions to one piece of the virus that is actually called the S gene. Now, if you think about this, I know we as humans, we know about genetics, we know about all the different genes we have. I think we know about maybe the sickle cell gene because that gives you sickle cell trait. What other gene do we know about? I think there's like an intelligent gene that people think exists. There's a bit of debate around that. We have a lot of different genes, right? Different parts of our genetic code that give a message to make specific parts. It's the same for a virus. They have different parts of their code that tell you to make different pieces of it. We in the lab, we actually test for the E gene. So that's a protein that is made that has a certain function and is not the S gene. So there's no actual even possible way that you can actually even test positive from the vaccine with the test we're using because they're looking in two different places. But on top of that, this is not a vaccine that gives you a weakened version of the virus. It is just instructions to make a small piece. And so that's where the difference is. And that's where the improvement is, because now no one can get the virus, no one can get the virus or the disease from the vaccine, but you still get the benefit of having the protection.
Now, I think, Dr. Weldon, an important point would be, I guess, you cannot test positive from taking the vaccine, but the question is, can you test positive after you have taken the vaccine and after you are fully immunized?
Yes, and that's been a rolling question for the last, I think, few weeks, actually. I think there's been a hint that, this has happened and people want to know how many. So I've got some clearer numbers. And in the last, what's today, the 28th, in about the last 20 days, in our lab, we've got about almost 400 cases that we've reported, which is a bit staggering, right? Out of those, we have around 10% that had 2 shots of the vaccine. So it's a big minority, right? 10% versus 90% who hadn't. What's interesting is that the timing of exposure, not the positive result, but exposure to someone who had the virus to when you had your last shot is actually quite important. I know we had, for example, someone who was unawares, obviously, was exposed, and then the next day got their second shot. In that case, you wouldn't have the protection from that second shot, right? You need to have those 2 weeks post-shot to have the full 95% effectiveness to not get sick, but to also reduce your chance of getting it to someone else. So yes, it's not shocking that anyone who has been vaccinated can get the virus and be test positive. And that's something I spoke about at the beginning. If you are around people who have it and you're not wearing your mask, you're not washing your hands, you're not socially distancing, there's no external protection, there's no wall, right, from the virus entering. But the vaccine will make sure if it does enter, that you have that internal protection that will be able to fight it off quickly. And what we are seeing, which is actually startling to see, when we assign a positive result, we actually assign a CP value or a CT value. It's the same term. It tells you along the test, at what point did it start to show that there was virus, right? It has a certain threshold it has to pass in order for it to be detected on the machine. The earlier that it goes up, that would indicate there was a lot more in there to start with, right? The later it will go up, that will indicate there was a lot less. So they're inversely proportional, right? What we're seeing is those who have the protection from the vaccine, so 2 weeks post their second shot, none of them, and I say none of them because that is the stat, none of them have any value that is low enough to say they had a lot of virus. So we have a cutoff usually around 35 to 40. We're like, that's a low level positive. They're probably not as infectious. That's where they all are. And it's actually quite shocking because you see groups of people who had the same exact exposure from a symptomatic person, those who are not vaccinated versus those who were, or even those who are immunized. They have very low CP values. So they have like a lot of virus that we're picking up versus those who are, and that's literally what we're seeing. It's almost quite, shocking to see, but that's the reality, and that's what we would expect. So, if anyone's asking, well, what's the benefit? Well, number one, you're not going to get as much symptoms or severe symptoms, and that's directly related to the CP value as well, right? So if you have a lot less in your system, less virus, then it's not going to inflict as much symptoms. But also what's tied to the CP value is you are less likely to transmit the virus to someone else if you have a lot less to give. You can only give what you have, right? And so those who are vaccinated having a lot less virus in their system, even though they've had the same exposure, is a very big deal. And I think that's good news, right? So I want to, settle that it's not majority of people who are vaccinated are positive, not people, because of the vaccine, now they're testing positive, that is impossible, and that's not the case. What is the case is that this virus is a lot quicker, transmits a lot quicker, but actually we're seeing that those who are vaccinated are at the end of lines of transmission. Now we can actually say, okay, that's a dead end. Let's, tackle another line of transmission, and that's good news.
I would like to add to that, Aderonka, because I think that it's important, because when people say, oh my gosh, 10% and all the rest, the fact is that we have a significant amount of people in the country who have the vaccine, a significant amount. And so right now our figures are for people who have had 2 doses, a full quarter of the population have already had their 2 full doses of the vaccine. So it is not unusual to see 10% of the positive cases which you have were people who would have been vaccinated. But the point which Dr. Weldon has made, which is key and critical, is that they are low-level positives. The low-level positives mean that it is unlikely that you are able to transmit it, or you are far less likely to transmit it. And the fact is that say for instance, if all of the 400 persons that tested positive were vaccinated or were fully immunized, there would be far less people to pass it on to. So right now, and we'll just do, let us say that there were 100 people that were positive, and out of the 100 people that were positive, none of them were immunized. Those 100, if those 100s pass it on to 3 people each, that means you have 300 people. And if those 3 people pass it on to three people each, it means you have 900 people. It will just spread very quickly. However, if 100% of those persons are immunized, or let's say 70% of those people are immunized, and they can't pass it on, you have 100, 70% of those people are immunized. Out of those 100, only 30 can pass it on. They pass to 3. That means you have 90. Those persons, and it follows in the same proportion. So that's how it goes down versus spreading. And that's the reason why it is so important for people to go ahead and get immunized. Another question of which is asked often is, why should I go ahead and get this vaccine if the rules don't change for me? Well, that I have to follow the same rules. There's a reason that you have to follow the same rules right now. It's because we are not at the place where we have herd immunity. We're not at the place where we have majority of the population that has a vaccine. And you can still become infected. You can still become a carrier. And what we're trying to do is get us to a place where less and less, there's that lower possibility of that happening. So when we get to the place where there's going to be more than half the population, then we can start relaxing those restrictions, and especially if we get up to herd immunity. But it is important that we continue to follow those restrictions now, especially because it's not as though if the government's going to, give you a wristband that says you're vaccinated, and that means that you don't wear a mask, and people who aren't vaccinated have to, and we're going to start discriminating that way. We're not going to start writing and changing rules that are going to say, oh, you have to wear a mask inside unless you're vaccinated, which means that you don't. And that we're not trying to go there. We're not trying to get to a place where we're having vaccine discrimination or those things. It's important that we get those numbers up so we can remove the restrictions or relax restrictions across the board.
So I just got another question, which I think goes to the next level is, can you explain how contact tracing works?
Dr. Weldon will be a little bit closer to me than that. She's not involved directly herself, and neither am I.
I'm not involved, and I will take this time to say that the Department of Health team and ESU team are, I do not envy them. I know we're doing testing, but sometimes I'm sending them an email with like 20 new people, and I'm just like, I feel sorry. I'm like, I'm sorry, but here we go. It is difficult. I mean, you have to it's like a big puzzle, right? You have to be piecing together how certain people may have got it. And it may seem like, well, at least we know who's positive. That's a great thing, which it is, but it's even more important sometimes to know how they got it, number one, so where they got it from, but then who else can they give it to? And that's really the race that we're playing here, is like, we need to know who's positive, how they got it, so we can see if anyone else in that setting is at risk. But then also, where have they been and who else is at risk before it gets to somewhere where we do have people that are vulnerable and are, really at risk of falling really ill from this. So I can't go into all the details. I know that there is a difference between an asymptomatic positive and a symptomatic positive in terms of how it's contact traced. And on that point, one of the other parts of this whole conversation is we still have asymptomatic carriers. Like, you don't have to have symptoms to only be tested positive for the virus. And I think we still have some who, question their positive results, which is fine. But we have measures in the lab. Every time we run the COVID test, we have controls to make sure that we know for sure that these results are positive. And we also have been doing the variant test, the rapid PCR test, which does actually target a different part of the virus to confirm each positive. So we're making sure our side, but if you do not have symptoms, it actually means they have to track back 7 days to the time you were tested. So if you think about that, I don't even know what I did 2 days ago, to be honest, right? 7 days worth of contacts if you don't have any symptoms, because then we don't know when you were infectious, right? So if you test positive and you're asymptomatic, it actually is a lot more work for the contact tracers. And that's in comparison to if you are symptomatic, they tend to, on average, go back 2 days because they know that you were infectious at that point and they have a more surety of that window. But it is a lot of work, and we have to be compliant. So I would implore and just say, if you do get contacted, to share as much information as you can. It helps to connect those dots. And at the last outbreak, if I can remember correctly, it started off really slow, and we had 2 people that were tested on the same day from the same department at different times. We both tested positive, and it was having to connect those dots. And that's what allowed, the contact tracers to come to the conclusion that we have an outbreak going on. So it's really important, because sometimes I know the number of under investigation cases is a bit alarming right now. I don't even know what it is at the minute. It's a lot. But it's because they need to all be contact traced and the dots put together. And I know that part of trying to fix that or help that is giving as much information at the time of testing. Because if you let us know where you work, why you're being tested, is it because you feel sick? Is it because you had close contact? That we can actually try to piece that puzzle together a lot quicker.
Thank you for that comprehensive response. Another question from somebody who's watching: is there any evidence yet of asymptomatic organ damage in COVID-19 immunized persons who test positive for the virus?
Oh, that's a whole lot.
I got lost after like the 5th big word. Sorry.
Let me try and break it down. Is there any evidence yet of asymptomatic organ damage in COVID-19 immunized persons who test positive for the virus?
Okay, so that's someone who's been immunized, had both shots, were asymptomatic. Do they have any organ damage? That was the question. I think one of the things that I'll answer the question. I'm not sure of that. I don't think we have that statistic yet, because we are just in the midst of people getting positive who are immunized. But when it comes to clinical measures or clinical indicators, should I say, they lag the testing, right? And that's an important thing. I know right now we see low numbers in the hospital, but if we go back to the last outbreak, it was the exact same way. We saw the numbers going up, and then we saw the hospitalizations, and then that led to, unfortunately, those 3 deaths. So it is a delay of like 2 to 3, even to 4 weeks sometimes. And so we don't know that yet in Bermuda. And unfortunately, if someone is asymptomatic, it's gonna take like months, even maybe, for those clinical indications to even become present. So we don't have that data yet. But that's not to say that those who have had COVID, I know in the last outbreak, I have a number of people I know personally who have had, even till now, some symptoms or some effects of having the infection. These are people my age. So it's it is something that, okay, I can just get it. I'm healthy. I'm an athlete and I'm fit. I've never had the flu for my whole life. I've never got the flu vaccine. And I've heard all of that. That's fine. I've never had the flu vaccine either, to be honest. And I lived in England where everything was free. I just didn't even occur to me to get it. But this is slightly different. And I think it wouldn't be a worldwide pandemic really if it was just the flu, right? But having said that, yeah, we don't have that data yet. So I guess we can wait a few months until we know that. I'm not sure.
Okay.
Adirondacka, if I may, I want to address a minor item of controversy because I think last week there was a tweet that was put up about saying that, you know, there is no flu in Bermuda, and people are like, oh, what, the flu is gone, and oh, what the government's trying to, you know, mistake it, and all the rest, and now it was misinterpreted, and so I know that it was rephrased and clarified. We do test for the flu when people may be hospitalized. Because every year people, especially senior citizens and young children who are susceptible to the flu, we test them for influenza. And if they come up positive for influenza, then they can be diagnosed as having the flu. There's other viruses that they have that they test for at the hospital. What I think was being said is that there are no reported or verified cases of flu where people have tested and gone to a panel and gotten flu. Now, that is unsurprising because the fact is never before have we ever had a situation where the entire country, at least not for 100 years since the Spanish flu pandemic in 1918, where we all had masks, where we're all washing our hands, sanitizing our hands in all buildings that we go to, etc. And I think that that is something that is very important to recognize and to understand. And it is also important to know that flu, the R number for flu is estimated at 1.4. Flu is far less transmissible than the coronavirus, where the R numbers are over 2 and in more transmissible variants higher than that. So it is unsurprising. It is unsurprising that the I think we lost Dr. Weldon just now.
Yeah.
I think it is unsurprising that we've seen such low incidences of flu taking place. And that is because of the fact that we have so many of these non-pharmaceutical interventions, in which they're called, taking place, whether it's the distancing and other things. So that is unsurprising because flu is far less transmissible than the coronavirus. And it's not unique to Bermuda. This is happening around the world where people like all of a sudden, and that's it. And I think so it's important. So I just wanted to make sure I clarify that. I know there was a lot of noise about that last week. And the fact is that it's very difficult to pass on because of all of what the things in which we are doing currently.
And I can add to that. Sorry, the electricity just had a little glitch, so I'm not sure what
Oh,
happened
boy.
there. I fell out and came back in. Genetically, the flu and coronavirus is like me and the premier and yourself. I don't care. We're all Bermudian, yes, right. So they're all viruses, but we're not related, as far as I know, right? Not closely anyway. So yeah, if you did a test on me, it would never be that it would be mistaken for being the premier, right? The first thing you see, oh, this is a female, this is a male, like that's totally different, right? So that's the difference between the flu and coronavirus. Yes, coronaviruses, there are others in the family can give you flu, but those are in a different kind of, I guess, branch of the genetics of coronavirus. The one that we are discussing, the COVID-19 virus, has its own genetic kind of markers that are unique to it, has its own fingerprint, right? We all have our own fingerprint. And so that is what is tested for. The specific unique part of the virus is what's looked at, not the parts that will give us, false results. And actually every test that gets approved has to test on other viruses, for especially COVID-19, has to test flu, has to test, I think there's RSV, there's like a long list of like 30 other viruses. It has to test those and show that it picks up none of them. It's not like it could be like 90%. It has to show it doesn't pick up any. There's no counter, like cross-referencing, that's what they call it. So that's actually part of getting the test validated. And then to add to what the premier said, the hospital actually, every time they do a COVID test, they're also looking for all the other viruses as well. And there's some other labs in Bermuda that do that full panel as well. So it's just that they were non-officially reported. But again, the measures in place are impacting all of those viruses that can be transmitted.
Well, thank you. Thank you both for your responses. To get another question from online, is government considering extending the time between the first and second vaccine shot, like in the UK, in order to accelerate the number of people with partial vaccinations?
That's a good question. It's something that was shared as an idea. Dr. Weldon and I were actually talking about that last week, and we put it over to the health teams. But at this point in time, we're not considering that. We have our schedule and we have our pace, and our schedule and our pace is going very well. And I would just encourage everyone to go ahead and register. Register. It is open to all. Anyone over the age of 16 can go online to gov.bm, that top red banner, it says register for the COVID vaccine, and go ahead and register and you will get your appointment. Appointments are fully booked. We're continuing to go. We are keeping our pace. Our target is 4,500 tests per 4,500 doses per week, and we are currently maintaining that. And that's the reason why I ran over these things. I did see someone had asked a question for clarity as to where I'm getting these figures from. I have this very large spreadsheet that I have done with a whole bunch of different calculations, and that just goes in projections in the future. But as of yesterday, this would be March 27th, the estimate is, and there's two different sections. One is the eligible population. So this vaccine is only available to those aged 16 and over. And so the eligible population at this point in time, it is 43% of the eligible population have had at least one dose. That is 43% of people have said, I want to go ahead and get it. I'm over the age of 16, and they've gone ahead and gotten their dose. So that means that we're certainly picking up. We want to get that number closer to 70, and then they'll get their second dose, will be fine. But we're certainly making progress. 43% of the eligible population have had at least one dose, and 30% of the eligible population have had two doses. When you take and to look at it, at what the total population is, that is 36% of the total population have had at least one shot, and 25% of the total population have had two shots.
Excellent. Thank you very much. So another question, and this is to do with testing sites. If the COVID testing sites are full, can doctors' offices do the testing?
Dr. Weldon,
yes,
you might be able to answer that better than me.
Yes, at the minute, and actually I heard this stat in the doctor's meeting I just referenced earlier. I think about 25% of our community testing actually comes directly from GP offices. So they are carrying, a real big part of the weight to make sure that we do test on a daily basis. Obviously, the different GP offices are catering for maybe different age groups. So you have pediatricians who specialize in the children, and then you have the others who can do all age ranges. I know that with obviously the schools being so impacted, that was definitely the focus in the last couple of weeks. But yeah, that is 100% what is happening. The samples come down to us for some of the GP offices. Some go to private labs, it's up to them. But that is a part of the number that is reported daily is coming from them as well.
So yes, you can get tested at your doctor's office, but call your doctor to check if they do it first, clearly.
Right, yeah.
And all right, so let me see what else we have here. So when you talk about herd immunity, are you including those who have recovered from the virus along with those who have never had it but are vaccinated?
So I would, if I could jump on that first, Mr. Premier.
Go right on ahead. You can jump on the entire thing.
It's obviously useful that, okay, I'll say that it's anyone who's had the virus already, right? Obviously, we had a large number in the last outbreak. Yes, they would have developed some type of protection, which would have some type of impact on what's happening now, because that was about 3 months ago, actually, when we had the last outbreak. And I know some other countries are giving, I think, passports or passes to people who have had coronavirus and saying, you are free to move about until a certain date. I know that's happening in Israel and other countries. The difference here is that with the study of getting the vaccines approved, they've actually compared it to natural infection and natural immunity. And there's a few differences, right? Number one, you create less protection. There's less antibodies created that will allow you to fight off the virus. So yes, you have some, but it's not as much as you could do if you're vaccinated. Also, the time frame that you have, this protection is varied, and it's between about 3 to 6 months. So again, everyone in the last outbreak is not necessarily protected in this outbreak, because we're literally at that 3-month period where the outbreak was starting to die down. And it's not surprising. I know we've seen this in other places in the world, reported that, a whole community that got COVID the first time is now having it the second time. Obviously, Manaus in Brazil has been mentioned a lot about that, but it doesn't last as long as it would with the vaccine protection that you have. So I think, I'm not sure what the premier's numbers, he's obviously got the numbers crunching, but I would imagine it would be just the whole population, because at some point, those who had a natural infection will not be protected anymore, right? And that will be like about 3 or so months afterwards, which is not great.
And so the next question, which I think will be a follow-on from that, is how long do you have to wait to get a vaccine after you have tested positive or recovered from the coronavirus?
I might be able to answer this, Dr. Weldon, because I did get this. So this is okay. So I can tell you what happens if you got the first shot, you get COVID or contract the virus afterwards, and then when you can get your second shot. I know the answer to that. It is once you recover, you can get your second shot. So I know the answer to that one, because I asked the CMO directly myself. And so I know the answer to that one. As for when you can start getting the vaccine dose after you've done it, that I don't know, Dr. Weldon. And I'm not sure if you have an answer for that.
I'm not entirely sure. That's well beyond what I do, but I would imagine it shouldn't be much different. But yeah, we can let the CMO maybe answer that in the next press conference.
Okay, thank you. And I don't know if you have these numbers, Premier, but how many of our positive cases are school kids? So I'll leave that question there. You have that number?
I don't know if we have it specifically. I know Dr. Weldon would know more, but I know that it was reported at Tuesday's press conference that about a third of the cases of which we've been reporting are school-age children. Dr. Weldon, you want to shed any more light on that?
I know we are keeping track of that since it was asked at the press conference, and to make sure that we keep on top of it. As far as the exact number right now, the last time I saw a figure was around 70, 80, around there. So obviously that fits with the third. But I can say definitely from, being at the first person that sees the result, which is literally me, the number of children is dwindling. It's definitely not in children now. It's passed on to the adults, and we're doing a great job in this relay race. I'll tell you that. It's we're spreading it. So it obviously was in the schools, and it's not that school-related cases are not still coming up, but it's definitely passed the baton, unfortunately, to us as adults, and we're spreading it.
And so I think this will just go to the next level in terms of questions. What is the under 16-year-old vaccine strategy?
The 16-year-old, we mean under 16?
Under 16 vaccine.
I think you have to wait until there's vaccines approved for the person under 16. Until there's something that's approved, I won't be giving my son and daughter a shot. Nope. Wait for it to get approved first.
Okay.
Yeah, there are a few that are currently doing those trials. So that is started, as well as those who are breastfeeding or lactating or pregnant. So those studies are happening now to see how safe it is. But yeah, until we get the complete data sets on that and know it's safe, we won't be doing any of that.
Okay. Another question from a viewer. Has there been a study done on the financial gain of allowing recent travelers to roam versus the detrimental impact of closing most of the, I think that's supposed to be most of the island?
Mm-hmm. I'm happy to tackle that. I think that at a broad level, to answer the question, a specific study that has made a number of assumptions on basic things that which the person is asking for, the answer to that question is no. But what we have done is that we have balanced the issues and recognizing the challenges of which we have with our hotel workers and our hotels. I think it's important to note that there are a number of countries that have closed their borders and do not allow persons into the country that are still dealing with the same issues of which we're dealing with. And I don't want it to, and so the fact is that I don't want it to people to think that certain things are a panacea. They are not a panacea. And so I recognize the question where it's come from, and I recognize there is the question of the strategy of which the government has had in place. I continue to believe that it is a correct strategy and will continue to make adjustments where necessary. But I think that on a broad on a broad base of views, I think it makes far more sense to make sure that we maintain our links with the rest of the world rather than closing ourselves off from the rest of the world as we're an island. And we need to make sure we take the mitigation steps in order to do so. This is unfortunate where we are with a very infectious strain. And so we look at things, we learn from things, we learn from lessons, and we proceed. But on the specific question of which was answered, I understand the impetus for the question as was a specific outline and assumptions done and to say this, and assume that if you have this many travelers versus this and what that means, et cetera, all the rest. I don't know. But what we must recognize is that there is significant foreign exchange earnings that does come in through travel and tourism, business travel and other things, and those would be lost from the economy. And that is significant when talking about a country that requires foreign exchange to survive.
Thank you, Premier. I have another question about the We Health Bermuda app. Is it working as expected? First of all, and are people receiving notifications when exposed to positive cases?
The answer is, I'll answer the second question and say, yes, it certainly is. I was rather frightened earlier this morning when I saw this little red dot at the top of my phone. I was like, oh my gosh, I've been exposed, haven't been exposed. And it was actually the monthly reminder that pops up on the We Health app. So I got a little bit worried there. But the answer to the question is, yes, it is working the way that it is supposed to be working. And it will work better the more people that use it. And I think that's the key point. We will be able to, I think, Aderonka, two questions that certainly we have to make sure that we're ready for Tuesday's press conference. One would be that question about how soon after you recover should you go ahead and get vaccinated. That's one. And the second one I think we can answer is how many codes have we generated from the We Health app? We can't necessarily, I know that there was a question of how many anonymous exposure notifications have been sent. And I don't know if we can get that because it's anonymous, but I do want to say at least how many codes have been generated out of the positive cases for the people who are using the We Health app. And the encouragement is it is free, it is easy to use, it costs nothing, it takes nothing, it is wholly anonymous, but what it can do is it can help notify you of an exposure. And the most important reason why you want to be notified of a possible exposure is because the app will be able to contact you faster than a contact tracer can. And if you have that possible exposure, you're not going to go around someone who's vulnerable. You're going to call in with health and, check and get the advice of which you need. And that's why it's so critically important. A day's time, 2 days time, that little bit of time helps, because if the way an exponential virus works and the way it spreads exponentially, if in that day you didn't talk to anyone, you're like, oh, I got an exposure notification, let me check, let me go get tested, let me make sure that I'm okay, then you are in a good space. However, if you don't get an exposure notification, if you go ahead and, go to someone's house, which you should not be doing right now. That's why I want everyone to not mix outside of your bubbles. Or if you go to work, which we're not doing right now because you're required to work from home. But if you did that in a situation, that means that you can seed additional people who can also spread it. That's what we're dealing with, the exponential spread of this virus. And we're trying to make sure that we reduce it back down.
Thank you, Premier. And I'll make sure we have those 2 points for Tuesday's press conference. I did get another question. So this relates to camps like football camp and cricket camp. Can those and the fact that they're outdoors, can these camps still go ahead?
Camps are not permitted to go ahead this week, no. The fact is that there is significant mixing of populations, school populations. Dr. Weldon can even speak to this, that what we saw in the issues of the spreading of the schools, it was individual kids on the weekend go to an event on the weekend. You know, maybe they were some extracurricular activities. I won't name them. They're doing some extracurricular activities, contract the virus there, went back to the schools, and then it spread. And so what we're trying to do is to minimize all that mixing. I recognize how incredibly inconvenient it is. Us personally impacted by it, less because daughter is in quarantine until Friday. But I do recognize and understand the challenge that this poses for parents. I recognize it. I understand it, and I wish that that did not have to be the case. But right now, it is the safest course of action, and our job is to minimize the possible points where spread can happen. That's all we're focused on right now, and that is the strategy of the governor of Bermuda, and that is the reason why we say stay in your bubbles, stay away. I know there's a few people that will ask about, you know, what about Easter? What are we going to do? What about, oh, my family is vaccinated, so why do I have to stick apart all the rest? We will be releasing guidance this week on how on those things. As I said, we did say we're going to be updating some things this week. The decisions which we made after we saw the results, and we're on Thursday and Friday to go ahead and put these restrictions in place. We recognize it very quick, and we haven't been able to flesh out all of the specific details, but we will be doing that, and we will be releasing guidance on Easter, on different things. And it will most likely be in line with the guidance that has come out from the CDC. Not everything, not about, you know, if you have a vaccine and you're exposed and you don't, we're not going there. We're not there yet. But on the things about how, if you are vaccinated and if you know all your family is vaccinated, you know, is it safe to then, you know, gather for Easter dinner and different things like that. So that guidance we'll make sure we put out this week.
Okay, thank you, Premier. Another question from a viewer: any plans to add more vaccination centers?
I don't actually think so. Right now, we're at a very, very good pace. The only thing that might happen is that if the COVAX facility does come through with the AstraZeneca vaccine or other vaccines that do not require the cold chain of which we have, then there may be, those may go into doctors' offices for doctors to administer them. But right now, on the broad level, no, we have the one at the hospital and we have the one at the Bermuda College, and that is working. And there's, of course, the people who are visiting rest homes. And I just want to say this. I am very saddened by the amount of children of persons in our rest homes that have not consented for their parents to be vaccinated. And again, no one can force it. It's not for us to force, but it is very concerning that the most vulnerable population, there are children who will not consent for their parents to be vaccinated. To settings like that, if there is a one seeding of a very contagious virus that we can have an impact and outbreak, rest homes were at the very front. We made sure that we went to rest homes directly. And the truth is that we do not have all of our seniors in rest homes vaccinated. And with the spread of this virus and the way that this new strain is spreading, it is likely that, just like there are cases in the prison, we will have cases in rest homes. And anyone who may be listening, watching on CITV, know someone, have a family member, et cetera, contact and say, you know, did you get auntie vaccinated? Did you call someone? Fine, have that conversation with your family, because we're playing that is the most vulnerable population which we have. We have provided them. We made sure they went first, but we know that there are those who are not, and we can see the impacts, as Dr. Weldon has explained. If you do contract the virus, you do not develop serious symptoms. You never get a huge viral load, and it just dissipates from you, and you are less likely to pass it on. If you don't have that protection, your immune system has to try to respond to it itself. And if you are not vaccinated, that is where you end up in hospital due to the immune response. That is where you end up in ICU. That is where you end up in a ventilator. And I beg persons, CITV, Facebook, wherever you're watching, if you know of someone in a rest home that you care about, that may be one of your family, talk to your family and the ones who are their responsible guardians and ask them whether or not they have consented for this person to get vaccinated. Because there are a lot that haven't, and I really fear what will happen if there are outbreaks in rest homes.
Thank you, Premier. Another question: how long does the vaccine last?
Dr. Weldon, I'll let you tackle that, because the answer is we don't know yet.
Yeah, this is the question we get. We get this in January, actually, before the vaccine arrived. It's really a waiting game, unfortunately. But the good news is that those who received the vaccine last June, July, they still, as the last was reported, had the same amount of protection as they did then. So it's at least 9 months, right?
Mhm.
But we just don't know when it's gonna fall off. We're just waiting for it to taper off, and then we'd know how long. It's really we have to wait. I mean, and people say, well, oh, this is, last year, it's only been a year and it's not been tested long enough. We didn't have a pandemic a year ago. I mean, a year ago, what day is it? I wasn't even here yet. I was in Oxford enjoying being by myself in my room. Like, we have to consider the pandemic, right? And so, I mean, I remember like last February, I had my conference. I had people like for my charity, the science conference. I had 100 people from all over the world flying. Could you imagine thinking of doing that now? That is just mind blowing. Like it is a different time, but it's only been a year. It literally has only been a year. And having said that, they've still gone through the same phases of trials. We already had safety data on mRNA vaccines prior to this one. HIV is an RNA virus as well, and so that was already in the works for an RNA vaccine. You had other viruses that were being done already. This wasn't the first one, right? And then you have people already working on this for decades. Coronavirus has been around. SARS has been around since, I think, early 2000s, if I remember correctly. And then you have MERS that came out in the 2010s. And there's a lot of funding for research on SARS and MERS. So that had progressed quite a lot before this pandemic. And so all of that combined, I guess just one piece that we're missing is, okay, when does this protection end? So we have to, unfortunately, wait.
Well, thank you. And I'm just looking at the time. It's 7:30. Believe it or not, we've been talking for about 90 minutes. And so, Dr. Weldon, as we close, I would like for you to give your thoughts. What closing thoughts do you have for everybody that's watching us this evening?
Wow, I think obviously we're all tired. I get asked that question a lot. How are you doing? And my answer is always, I'm tired. I'm just in a habitual state of tiredness. And it's not just because I'm not sleeping as much as I would like to, because I used to sleep a lot when I was in Oxford, to be honest. When I was in the lab, I was in my room chilling. I do fantasize about that sometimes, like what was. But I think overall, we're fatigued with being in a pandemic. I mean, I've never been in a pandemic. I don't think most of us have been in a pandemic. And it's just, and then we've heard about the flu pandemic before, which is like a history lesson. But to live it and be in it, I think we're all just tired, and that's fine. We know, like, we're all in the same boat here. And I know that restrictions that do come out affect others differently. And I know some of us, are on the front line, some are not on the front line, but it's still affecting us all, as very greatly. But I would say anything and everything that you do, everyone on CITV, on Facebook, and then everywhere else this is being broadcast, think of us as a collective. I think one thing that I can truly say as a Bermudian is we have very strong national pride, and I'm proud of that. When we travel abroad, we have to defend how we didn't get lost in the Bermuda Triangle and our accent, and why in the US we sound UK British, and why in the UK we sound American. Like we all have to go to that, and we are proud to be from this country. But I want us to think of others in our lovely country and island home as we make these choices. And I know I've said it publicly that, this is as a result of us adults not following the guidelines. But let's just think going forward, when we do get through this, because we've done it before. A year ago, and I'll say this, a year ago, it's not that we're in the worst outbreak, right? A year ago, remember, we were only testing symptomatic people. Mm-hmm. And we were not testing your household contacts. It was just presumed that they were positive because you were in the same house. They were put on quarantine and you had to sit. So we wasn't doing that much testing. So we were only testing those who had symptoms. We were not testing your spouse. We were not testing your children. And so our numbers were a lot lower a year ago. But just a reminder, it took us 3 months from the time the airport was closed until we had no active cases. 3 months. It took us 3 months to get out of that, right? We went into shelter in place and we were able to test our way out and ease back in and know that we were doing it safely. We were a lot quicker the last outbreak, right? We never, I don't think we ever got to 0 active cases, but we went to a place where there was 0 local transmission. And I think it was really exciting. It was only imported cases. And those imported cases, we're not giving it really to anyone other than maybe their spouse or someone in their house. That was a good space to be. And I remember in January, you know, we were wondering where all the samples were. Like, no one's getting tested anymore towards the end of January and February. And so we got through that outbreak quicker because we had the, you know, the resources and we moved quicker. This time, yes, the virus seems to be transmitting faster, but we can get through it and we will. We just all have to do our part and consider the next person. So that's my final thought.
Thank you, Dr. Weldon. Premier, I'll give you an opportunity as well to give your closing thoughts.
Thank you very much, Adaraka. I want to thank Dr. Weldon for her time, for energy and efforts, certainly for leading the lab and advising the government on scientific matters. And I want to also pay homage to all of the people who have been on the front lines of this pandemic, especially those courageous healthcare workers in the Ministry of Health, those that are out vaccinating, those are out testing, those are out collecting samples, those are doing all the support work, et cetera. It's incredible, and it's so gratifying to see all this hard work. I am a fan of Twitter, and I saw something that was posted on Twitter last evening, and it was a very funny song, but it went something like this: "The pandemic is not over, even though you are over it." And the fact is, all of us are over it. Trust me. Someone asked me how you're doing. I said, I'm longing for the day that I never have to say COVID-19 again. And that's literally how I feel on an every given basis. And I recognize how incredibly painful and incredibly numbing this must be. I recognize the impact which it has on businesses. I recognize the impact which it has on taxi drivers. I recognize the impact that it has on parents. I recognize the impact which it has across the country and across the community. I recognize that. What I must say is that this is a small spike, not a small spike. This is a spike, but we can make it a very quick one as we continue to do the public health measures. If we all do what is necessary. Don't find yourself and don't think yourself too cute and say, oh, I don't have to deal with that. Oh, I don't have to do with that. Oh, I have to do with that. Listen to the public health advice. Listen to the directions which are being followed, and make sure you do your part. That's what's important. As long as everyone does their part, go ahead, and please don't feel afraid to pick up the phone, dial 211 and say, these people over here are having a party, and I think it might cause a problem, because one party, one transmission can lead us to a certain place. And that is the point that we all have to remember. When exponential spread of a virus happens, you spread it to 4 people, those 4 people can spread it to 16 people, those 16 people spread it to 64 people, and when you're there, you're out of the woods. And that's where we can find ourselves. And that's the reason why we're asking everyone to take a pause, make sure you separate yourselves, stick inside your bubbles, continue to go through the process, and we will be okay. The government is going to continue to work. We're going to continue to refine what it is that we're doing. We have been able to manage this pandemic well by continuing to refine our strategies, and we're going to continue to do that. So I ask everyone to please pay attention to public health advice. Please continue to do what is necessary to keep yourselves and your family safe, and collectively as a country we'll go through this. Thank you, Director Wilson, for you and your team, your communications team, for doing all the work to get us on through. And I also want to thank all the media partners who have also broadcast this on their station, as I know that Bermuda Broadcasting did do a simul broadcast on their stations as well. So with that, I wish everyone good night. And if there are more questions that you have, feel free to drop them in the Facebook link, and we'll get to those on Tuesday at our press conference, which will kick off at 5:30 p.m. Thank you and good night, everyone.
Thank you, Premier. Thank you, Dr. Weldon. Good night, everybody.
Bye-bye.